This is Dr. Zariun. Today we'll discuss about anatomy of human kidney. So the urinary system, there is a organ of urinary system, kidney, ureter. Urinary bladder and the urethra is included under the urinary system. So today we have the kidney, function of kidney, external structure of kidney, covering of the kidneys, and the internal structure of kidney. The kidney is located on the posterior abdominal wall. It looks like bean shaped. Right kidney is slightly lower than the left kidney, and the right kidney because of the presence of the largest organ, which is called liver, but both kidneys superiorly located T12. The left kidney is inferiorly reached up to L2 and the right kidney is reached up to L3. The function of kidney, the major function of kidney, it used for plasma filtration, excretion of waste product, and acid-base homeostasis. That was done by nephron. The major structures that used for plasma filtrations are renal corpuscle, which is called glomerular capillary. The other function is hormone production. It produces erythropoietin hormone, and it produces vitamin D. It is the sites of vitamin D metabolism. So the external structure of kidney, it look like bean shaped. The weights of the kidney is around 120 up to 200 gram. The length is around 10 up to 30 centimeter. The width is around 5 up to 6 centimeter, and the thickness is 4 centimeter. It has inferior pole, superior pole. At the superior pole, there is the organ which is called suprarenal gland is located, and there is a lateral border which look like convex, and the medial border is look like concave. So the medial border of the kidney is called hilum of kidney because of different structures are enter into the kidney and different structures are exit from the kidney, like blood vessel, lymph vessel, nerve, and the ureter. So posteriorly, the kidney is covered by the ribs, rib 11 and 12, but the right kidney is slightly lower than the left kidney. So at the level of T12, we can cut and dissect, so we can see the two kidney. There is a vertebral and there is abdominal aorta, inferior vena cava. They are found on the right side and the left sides of abdominal aorta, inferior vena cava. So the kidney is covered by, adhered by the strongest structure, which is called the fibrous capsule or the renal capsule, and the other fat, which is perinephritic fat, it cover the kidney. So the perinephritic fat posteriorly, which is thick, but anteriorly, which is thin. And the perinephritic fat, it gives physical support and physical protection of injury. And next to the perinephritic fat, the kidney is covered by the renal fascia. It has anterior layer and the posterior layer. The two layers join together posteriorly, and the two layers join together posteriorly and anteriorly. They form the renal fascia, cover the kidney, the inferior vena cava, the abdominal aorta. So the renal fascia is called pre-renal layer fascia of Toldetti, which cover those structure that find on the posterior abdominal wall. Anteriorly, the renal fascia is covered by the peritoneum. The internal structure of the kidney has different internal structure, the renal sinus or sinus renalis, which contain fat. Fat is located within the renal sinus. The renal pelvis is formed from the renal calyx, the renal medulla, and renal cortex. So renal medulla, renal cortex, renal calyx, and renal pelvis, those are internal structure of the kidney. The thickness of the renal cortex is around 4 up to 11 millimeter, and it is a site of plasma filtration. And the renal column, it is a continuation of renal cortex. The continuation of renal cortex which is found between the renal medulla. The renal pyramid and the renal cortex, they contain the nephron. But the nephron የምንለው የሚገኘው ከሬናል ፒራሚድ ወይም ደግሞ renal cortex ውስጥ ነው። The cortical parts of the kidney contain the renal corpuscle, the proximal convolutive and the distal convolutive. They are located within the renal cortex. So we have 7 up to 8 in renal pyramid. The renal pyramid has base of renal pyramid and apex of the renal pyramid. The renal medulla contains the parts of nephron, that is a loop of Renal, and the collecting duct is located within the renal medulla. The renal papillae is open into the minor calyx, the opening of papillary duct. ስለዚህ እነዚህ papillary duct ላይ open የሚያደርጉ ናቸው። Finally, the minor renal calyx together they form the major renal calyx. The major renal calyx together they form the renal pelvis. So the renal pelvis is mainly formed from the major renal calyx. Finally, the renal pelvis it give ureter. So ureter is the continuation of renal pelvis. So those are the internal structure of the kidney. This is all over about the internal structure of kidney, the external structure of kidney. Totally, this is all over about gross and microscopic anatomy of kidney. Thank you very much for watching my video. Please subscribe, like, comment and share.